Meantime, do any of you remember this?
I also have a health care plan that would save the average family $2,500 on their premiums.
Not quite. Didn't happen. Now a lot of Democrats are at a loss for words.
I thought the Affordable Health Care Act was to save $2,500 per family. What happened?
Well, is the health care law confusing you? It turns out lawmakers are pretty stumped, too.
I thought the Affordable Health Care Act was to save $2,500 per family. What happened? I was leaving the challenge.
I voted no, so I'll let these guys.
That's called throwing your colleagues under the bus. Anyway, Town Hall's Katie Pavlich. She's not laughing. What do you make of all this, Katie?
Well, I think at this point, Democrats are laughing to keep from weeping when it comes to trying to defend Obamacare and another broken promise that it was supposed to save families $2,500. And this was in Minnesota, which teeters on being a blue and a red state. And Representatives Amy Klobuchar and Colin Peterson are the two representatives there who are the ones who did vote for Obamacare. And they're actually showing us that people at town hall meetings are paying attention to their wallets and that Obamacare is going to be an issue when it comes to the election just a couple months down the road.
What if these guys get reelected, though, Katie? I mean, you could take from that, and Democrats probably will take from that, that they have met the monster and faced it off, and that health care will live to fight and be around and grow its tentacles in our economy for another day.
Well, we'll have to see if they do get reelected. You know, we can only at this point tell what history shows, and we look at the 2010 election, which was solely based on Obamacare, and that was before it was even implemented. This year, now we have people seeing not just their premiums increasing to, you know, $2,500 a month, but also their deductibles increasing to something like $10,000, which is just insane and ridiculous. And on its face, the Affordable Care Act is very unaffordable. And so the polling shows that people's issue is Obamacare, and that they're not happy with people, including Democrats who voted for this. By the way, Democrats are not happy with those who voted for it.
If they're losing their youthful base, so especially when Michelle Obama was saying this last night on Jimmy Fallon. Listen to this.
Young people can stay on their parents' insurance until they're 26, but once they hit 26, they're on their own, and a lot of young people think they're invincible. But the truth is, young people are knuckleheads.
Now, what she was trying to say is that young people think they're indestructible and they'll be healthy forever. But you could be a young person listening to that and say, well, I'm not a knucklehead. I just don't think it's worth my time or trouble.
Well, my biggest issue there was not necessarily her calling young people knuckleheads. It was that she said that 26-year-olds are on their own, as if it's a bad thing to be on your own by the age of 26 years old. But the problem is that young people are knuckleheads not necessarily because they're not signing up for Obamacare. They've actually come around and been smart on that issue because they can't afford it, and it also doesn't offer the coverage that they need. But they were knuckleheads for voting for her husband 2 elections in a row because now they're stuck with this health care bill. And because of Obamacare, because of Obamacare, though, they can't go out into the individual market and actually get affordable coverage as they could before Obamacare. So
Katie,
disagree with her there.
Thank you very, very much. And you're not a knucklehead. Katie Pavlich. Well, waiting for your health care premium to go down? Well, you might want to keep waiting. A new study says that the law's tax on insurance companies will go right to your wallet. Former CBO Director Doug Holtz-Eakin here. He is with the group behind that study. Doug, what is this saying? That it's inevitable that insurance companies pass this along to you?
Yeah, they're really going to have no choice. This is one of the worst design taxes I think I've ever seen. It takes $8 billion out of the insurance industry no matter what market conditions are, and it gives them little choice because it's a cost of doing business, but to bake it into the premiums. And they aren't making a ton of money, so they can't take it out of their dividends. They're competing like everyone else for workers, so they can't pay less. And we're going to see this go right into the middle class and right into the premiums they pay.
All right. Now, the Democrats and a lot of those who support the law argue you're overstating the case. The premiums have already gone up, sometimes in anticipation of this. So if you're worried about a shock effect, the shock's already come and gone. You say what?
I say that the tax starts in 2014, and there was no way that the regulators would allow them to raise premiums on a tax that happened in the future. So you get another shock this year. The past shocks had to do with Obamacare regulations. This is about the tax. And in many cases, if they've got $1 of tax they have to pay to the government, they actually have to raise their premiums by $1.50 because they wrote into the law this idea that they couldn't deduct it as a cost of doing business. They have no choice but to pay it. So they're going to pay an income tax on their insurance tax, which is the classic double tax.
Amazing. Doug, it's always good seeing you, Doug Holtz-Eakin, American Action Forum. In the meantime,